We see this day after day after day, that we're unable to adequately staff our emergency departments.
Doctors in Winnipeg are sounding the alarm over grave concern at the rate senior nurses are quitting, saying nursing morale is at an all-time low and the staffing situation in emergency rooms is in critical need of immediate action. An open letter sent to the Manitoba government, signed by more than 60 physicians, warns the current workload for emergency department nurses with the increasing numbers and acuity of COVID patients is exceptionally high. Everyone who comes to the emergency department could have COVID, and the hospitals rely on our ED nurses to find and isolate COVID cases before admission.
Emergency medicine is a team sport. It's not something that we can do on our own.
Dr. Noam Cates is among the physicians who signed the letter. Cates says Sunday night was another example where multiple beds designated for the sickest patients at the hospital couldn't be used because of staffing shortages, and he says that has become common.
And our nurses, quite frankly, are often compromising their physical and mental well-being, and it's not sustainable. Where we are at with our nurse vacancies is critical.
In most areas, we were already in a shortage before the pandemic, so now it's just worse.
Melanie Gauthier, president of the Canadian Association of Critical Care Nurses, says the low morale and high rates of burnout are being experienced by nurses across the country. The third COVID wave in Canada saw high case numbers in BC, Ontario, and Manitoba, and nurses are exhausted, distressed, and many of them are leaving the profession due to burnout.
So I think that there will be a period of time where we will have a nursing shortage.
A statement sent to City News by Doctors Manitoba says critical care specialists have told us a lack of nurses is a key limiting factor to opening more ICU beds. ER physicians have raised concerns about the vacancy rate for emergency nurses, and they are worried the shortage will affect patient care. Surgeons have identified the nursing shortage as the top barrier to addressing the surgery backlog. Simply put, Kate says, the nursing shortage affects everyone in need of critical care. People who don't need the hospital today might need the hospital tomorrow, and if there isn't enough staff available, the quality of care they receive could be impacted.
And we see this constantly where we're getting multiple very sick people at the same time. So it's a question of us physically not being able to be in two places at once.
A spokesperson for the Manitoba government says we certainly appreciate the insights relayed by all of these committed physicians, and we certainly share their concerns about our dedicated emergency department nurses and the particular demands and stresses they have borne during COVID-19. In Winnipeg, Mark Neufeld, City News.